Hello everyone, we have a 3-year-old boy and he has dry eyes, photophobia. He has some difficulty in adapting to darkness. He has dry, scaly skin, hyperkeratosis, and dry cerebral plaque on the bulbar conjunctiva also. Most likely diagnosis of this patient is vitamin A deficiency. The condition usually manifests in the second to third year of life. In our case, the child is 3-year-old. The clinical feature of vitamin A deficiency are impaired adaptation to darkness, which may progress to night blindness. And this is the problem in our patient also. Photophobia, dry scaly skin, it is there in our patient also. Dry conjunctiva, so-called xerosis conjunctiva, dry cornea, xerosis cornea, wrinkle cloudy cornea, that is keratomalacia. Bitot spot, dry silvery gray plaque on the bulbar conjunctiva. Follicular hyperkeratosis of shoulder, buttock and extensor surface are less common finding, but they are there. So we can see xerosis cornea. We can see keratomalacia, cornea just about to melt. Bitot spots, and there is follicular hyperkeratosis. Now let's look into other problem. Thiamine deficiency, option B, is incorrect. It is associated with infantile adult beriberi and Wernicke-Korsakoff syndrome in alcoholic. Manifestation of infantile beriberi appear between age of 2 to 3 months. Adult beriberi is characterized by dry and wet. Dry beriberi described as a symmetrical peripheral neuropathy, accompanied by sensory motor impairment, especially of the distal extremities. Wet beriberi, of course, neuropathy is there. In addition, patient has cardiac problem, cardiomegaly, cardiomyopathy, congestive heart failure, peripheral edema, and tachycardia. So wet has neuropathy as well as cardiac problem. Well, when in fulminant cardiac syndrome, there can be dyspnea, tachycardia, cyanosis, cardiomegaly, a type of, you can say, cardiomyopathy, which is usually a type of systolic cardiomyopathy. Well, if you look into beriberi, you can see patient has confusion, emaciated, wrist drop, great weakness, foot drop, loss of tendon reflexes, burning, tingling, numbness. All these are so-called feature of peripheral neuropathies. Okay. And beriberi heart disease, cardiomegaly is there, which is due to systolic dysfunction. Now, unless we discuss Wernicke-Korsakoff syndrome, discussion of B1 is incomplete. The classical type of confusion, ophthalmoplegia, and ataxia. Additional features are confabulation, personality change, memory loss, cannot afford to forget. And damage occurs in medial dorsal nucleus of thalamus and mammillary body. Now look into this. This is the dorsal medial nucleus of thalamus, as I showed to you, and mammillary body. Look into this, the mammillary body. Don't forget these two important structures. As for option C, A, riboflavinosis. Riboflavin is an integrated part of coenzyme that participate in multiple cellular metabolic pathway, energy producing respiration pathway. Vitamin is present in many food, including meat, fish, egg, dairy product, green vegetable, yeast, and enriched food. Now, I have a question. Which biochemical step riboflavin is involved, is needed? Stop the video, write down the answer. Well, B2 is needed for component of flavin and FAD, FMN, and these are cofactors for in redox reaction, succinate dehydrogenase reaction to in TCA cycle. How to remember? FAD, FMN are riboflavin. Lovely mnemonic to remember. Okay. Deficiency cheiliosis corneal vascularization, 2 C's or B2. Again, easy mnemonic to remember. Look into this lovely picture of, you can see this corneal vascularizations. Don't forget, it's a very important slide. Many patients who present with riboflavinosis deficiency are usually sicken and with anorexia nervosa. Maladaptive syndrome are, of course, they can cause riboflavin, but less common as compared to anorexia nervosa. So in riboflavin deficiency, corneal revascularization, very, very important. Don't forget this. Otherwise, you can see chiliosis are the features. You can see chiliosis. This is glossitis. Option D, scurvy, ascorbic acid. What are the normal functions? Say oxidant also facilitate iron absorption by reducing it to ferrous state. It necessary for hydroxylation of proline to lysine and lysine in collagen synthesis, and that's why whenever there is vitamin C deficiency, it leads to reduce wound healing. It's also necessary for dopamine beta hydroxylase, which convert dopamine to norepinephrine, is found in fruit and vegetable, and ancillary treatment for methemoglobinemia by reducing ferric into ferrous. Well, as now when deficiency there, characterized by impaired collagen synthesis and damaged connective tissue, which I mentioned in the previous slide, and other things are ecchymosis, petechiae, bleeding gum, hyperkeratosis, and impaired wound healing are the features. Look into this corkscrew hair, perifollicular hemorrhage, corkscrew hairs. This bleeding gums. Typical vitamin C deficiency, perifollicular hemorrhage. In addition, they also have dry skin and hyperkeratosis and keratoconjunctivitis sicca, but this can be seen in vitamin A deficiency also. Okay, but there are many other features which are seen in vitamin A deficiency, and these are not seen in scurvy. Hypervitaminosis A is usually due to injection of excess amount of vitamin A for several weeks or months. Symptoms include anorexia, pruritus, lack of weight gain, irritability, and seborrheic cutaneous lesion. And the most important, don't forget, it can lead to benign increase intracranial pressure. This is the most important. In addition to that, there are non-scarring frontocentral alopecia in hypervitaminosis. There may be erythematous skin rash in hypervitaminosis A. There can be nail dystrophy. Golden line to remember. Suspect vitamin A deficiency in 2 to 3 year child with impaired adaptation to darkness, photophobia, dye skin, xerosis conjunctiva, xerosis cornea, keratomalacia, Bitot spot, and follicular hyperkeratosis. Thank you very much.